Hey, this is Don with the Clinical Trials Guru. Again, that website is www.theclinicaltrialsguru.com. And welcome. One of the things that came up about from somebody sent us some information. Somebody's interested in getting into a study, but the conversation came up about is my information protected? Do you guys protect our information the way hospitals do? And in clinical research, yes, we do. We do protect your information. It's protected under what's called the HIPAA laws. And the HIPAA laws is, it's all your healthcare information, whether it's medical or mental health, is protected up under this Privacy Act. The people that have to follow these laws to protect your information, I mean, obviously you got research companies, clinical sites. We have to follow those laws. So hospitals, doctor's office, any medical clinics, any type of clinic, medical clinic you go to, or mental health clinic as well. I just don't want to exclude them. HMOs, government programs like Medicare and Medi-Cal or Medicaid, they all have to also follow those laws in protecting your information. Who else? And also what's called these healthcare clearinghouses. And what a healthcare clearinghouse is, those are those companies that you find on the internet when they're offering, hey, sign up here, you can get health insurance benefits. You give your information to them and they pass it along to the to different insurance companies that find you the best rate. They also have to protect your information. Now, who is not required to follow that information? Life insurance insurers, your employer, workers' compensation carriers, many schools and school districts, state agencies like Child Protective Services, and many law enforcement agencies. The other issue too that I want to talk about with this too is what information is protected. Information that your doctor has, information you give your doctor, your nurse, or any healthcare provider that you might give that's working in the arena that's there to provide you with either mental health or medical services. Any conversations you have with your doctor or any of those healthcare providers, that information is protected. And this is all related to the treatment and the care of you. Any billing information, any information is transmitted via computer. And I think that's pretty much it under that arena. Now, the other thing is that we discuss is how is that information protected. Again, it's protected up under this privacy rule or this healthcare program or law that's overseen by the federal government. And what happens is that if someone within those arenas that I listed, doctors, nurses, hospitals, or whatever it may be, clinical research companies, if they give your information out to people that you did not give them authorization to give that information to, then you could contact the U.S. government and they will tell you exactly what you need to do and what your rights are. And they will definitely, I can guarantee you, definitely come down hard on those agencies or those individuals that do disclose your information without a written consent from you. They must have a written consent. Let's see what else. Okay, what rights do you have to your information? Okay, this is the other thing that we talked about. What rights do I have to my information? You have a right to go to those places that you visited that has your information and request to see a copy of your medical records. Now, if you ask for them to get you a copy, they can charge you for that because you're asking them to give up their time to make copies of that. They can charge you for that time. They can also charge you for, what they spend on, using paperwork, anything that they may send in the mail, they can charge you for that. Let's see what else. The other thing you want to do too, when looking at your medical records, if you go through them, if you see anything that's incorrect, have them corrected. Also too, when you first go in, whether it's a hospital, clinical research company, you're going to sign this form. And some of you know what a consent form is. Within that form of the Bill of Rights, or sometimes the clinical sites may have a separate form, and that form is may list who you want to have access to your information, and they should go over that with you. Sometimes our doctors in the clinical research arena may need to speak with your private doctor, be it your primary doctor, your internist, or it may be your psychiatrist, or anyone that provides day-to-day care for you or any type of care for you in the past. We may need to speak to them to get information to assure that this clinical study we're putting you in is the right thing to do. So all that's protected, all that falls up under that HIPAA law. And again, the HIPAA is HIPPA. If you believe, again, your rights are being denied, if you believe that someone is distributing your information for marketing purposes or for whatever the purpose may be, without your written authorization, you can contact the U.S. government. So again, you have control of your information. So remember that. You have control. You control all of this. So this is Don Walters signing off from The Clinical Trials Guru. Again, that website is www.theclinicaltrialsguru.com, and take care.